how does drinking alcohol and smoking affect men's and women's heart differently?
Smoking is one of the most worst risk factors. Now, there's something before I didn't tell, I'll just tell you, there's something called risk factors. What we have seen is from millions of patient studies that if you have any of these, your chances of getting a heart disease is higher. It's called major risk factor. Number one is tobacco use or smoking. Number two is diabetes, blood pressure, high cholesterol, strong family history, overweight, stress, lack of sleep. These are multiple risk factors. So tobacco and sweets. Tobacco forms one of the most important risk factor that can cause heart disease. The way it does is that nicotine and other substances, they damage the internal lining that, as I told in the beginning, called endothelium, number one. Number two, also they make your arteries are very, very hard. So both ways, they increase the blood pressure, damage the artery, that's how you get a heart disease. Alcohol per se directly doesn't affect this type of heart disease we are talking about, the blockage in heart arteries. But alcohol when you take, it increases risk of cancer, liver damages. Also when you take excess alcohol, it can damage the heart muscles. It's called alcoholic cardiomyopathy. So both are equally bad. Smoking, I'll never advise anybody to smoke, and avoid also what's called passive smoking. If friends are smoking also, you are as good as smoking. Alcohol you can enjoy occasionally is fine, no problem.
And vaping, which is another thing.
Vaping, there are dangerous. Hookah, vaping, they're as dangerous.
Okay.
And very commonest, whenever I see a young boy or girl coming with a heart attack, first I send the parents out, then ask them, did you have a vaping? You'll be surprised, most of the time they're either doing vaping or hookah or binge smoking. Very, very common.
So how is it worse for bad or good? Like what is more for men or women? Women smoking is
equally bad.
Equally bad.
And you have to understand the heart attack occurs because the artery get blocked. The artery can get blocked from cholesterol deposit over 30, 40, 50 years. Somebody is getting heart disease at the age of 55, 60 or 70 years of age. Or the artery can suddenly get blocked from because of all these reasons. So don't think that anybody young age also, because young age you will not get a heart attack. You'll be surprised, almost 30% of the people who get heart attack don't have a blockage. Because of all this lifestyle change, they get these heart attacks.
Okay.
Yeah.
What about if women are smoking, say from the age of 17 till the age of 29, and then they conceive and have a child. They stop, they conceive, they have a child. Does the child have risk of any kind of pulmonary, heart, kidney, anything that could get affected? Because the mother was a smoker?
Ex-smoker, no.
Okay.
If he's not, they have stopped smoking before child has conceived, then the effect on child is very, very less. On the other hand, even in the short period during pregnancy, it will have a serious effect on the child's health, both short-term, long-term. So as long as you stop smoking, and especially the effect of smoking on lungs, within 6 months almost comes back to normal level.
Okay.
So there is a good thing about smoker, those who are smoking, you stop today, most of things you can reverse it, including heart disease also. Heart disease, in my college days when we were studying, we were saying is irreversible. Once it happens, it's a continuous, you cannot reverse it. Today we know that vast majority cases, you can reverse a large extent the heart disease.
Namaste, Jai Hind. You're watching ANI podcast with Smita Prakash.
अगर हम उसको मस्जिद कहेंगे तो फिर विवाद होगा.
The issue is टूटा है क्या भारत?
400 पार का मतलब ये है कि संविधान खतरे में है.
क्या हम लोग ये निर्देश देते हैं कि फला को गिरफ्तार करके जेल डाल दें?
वही तो कह रहे हैं सब.
ये बेबुनियाद निराधार आरोप.
सच्चा सुनना चाहो देखो स्मिता प्रकाश ANI. It does not lie.